Rule 4. Solve the problem keeping in mind the four core ethical principles of medicine: autonomy, beneficence, non maleficence, and justice. Keeping that in mind, let's move on to the next question. You're working on a weekend and are providing cover for two other wards in addition to your usual ward. You're due to finish in 15 minutes, and you're contacted by a nurse from one of the other wards, whose name is James, and he asks you to speak to the relatives of Elizabeth, a patient who has recently been diagnosed with cancer. James tells you that Elizabeth has been informed of the diagnosis, but that the relatives now want to talk to a doctor to discuss the diagnosis and the management plan without Elizabeth being present. You do not know Elizabeth, and the regular staff are not working on site this weekend. Rank in order the importance of the following considerations. So, this is kind of a little bit of a different question. These do come up from time to time. So, pause and do your ranking. The answer suggested is D, A, C, B, E. Let's discuss why. So, the patient's right to confidentiality. Yes, absolutely, blindly. That is the most important thing. The fact that they want to talk to you about her without her being present or without her knowledge and her consent is absolutely wrong, and it should be the number one consideration um, when you're ranking these. The next one is A, the risk of miscommunication with the family as you're unfamiliar with the patient, her diagnosis, and management plan. So A is very similar to C, and you might confuse them, which is the distress that the relatives would have if they don't have the opportunity to discuss the concerns, which are fair, but spreading misinformation is more dangerous and might be more distressing than them not having the opportunity to speak about this. You could explain to the family that I'm sorry, the regular staff aren't here, and I'm not very aware of her situation or very qualified to talk about cancer and its treatment with you as an FY1. And so, that's something that could be explained, but the miscommunication would be disastrous and should be avoided. So that's important to consider. The next thing would be the conflict with James. You could also easily, talk to James and explain to him that, it's not one of your regular patients. You're an F1 and you're not qualified to talk about cancer with this patient or their relatives at this point. And it is important, but it's not that important. It's an interesting question because they're telling you to rank in order of importance of consideration. So you have to kind of be wary. And then the last one is that the conversation is likely to be time consuming. This is absolutely the least important out of the three, out of the five, because it doesn't really matter if, you know, there is an important conversation to be had. If patients are distressed or their relatives are distressed, it is our duty to give our time to them and answer their questions. In another world, yes, you could, hand over to someone, maybe more senior or someone who is in Elizabeth's team to have this conversation with them. So that would be the most appropriate option in the situation, but it's the least important when you're having these considerations. You can now pause and read the rationale provided by the UKFPO, and let's move on to the next question. You're working on a busy surgical ward and are on your way to speak to a patient on another ward about their elective surgery. Mrs. Hill, who is the wife of one of your patients, approaches you. She tells you that her husband was meant to be discharged today, but that no one seems to be doing anything. She's very upset and she has made plans for his discharge, and she begins to shout at you. Your consultant told you earlier today that Mr. Hill will be need to observe for a further 2 days before he can be discharged. Rank the appropriateness of the following actions. Pause and do your ranking and then come back to me. So the answer is D, C, A, B, E. Let's see why. So absolutely the best option would be to explain to both Mrs. Hill and her husband why he's not being discharged today. This is important because you're keeping the patient themselves in loop. It's about his care, and although the inquiry is coming from the wife, it would be nice to go and talk to both of them and explain to both of them what's happening. And so this is absolutely the best option. Also, at your level as an FY1, you can have these conversations. It's not like breaking bad news of cancer, so it would be appropriate for you to handle it on your own. This is why the next option is C rather than A, because you are capable of talking to Mrs. Hill about why he's not being discharged today. And so you can take her with a chaperone to a side room and talk about it rather than having your specialty trainee involved, like in option A, and asking him to talk to Mrs. Hill. This will also probably, make the wait longer and make her annoyed. Similarly, telling her that you will speak to her after you come back for the ward will make her more annoyed and more upset, and is less appropriate. But the least appropriate by far would be to inform Mrs. Hill that you cannot speak to her until she has calmed down. This is just likely to aggravate the person and make the situation much, much worse. So this was quite straightforward. You can read the rationale now, and then let's move on to Rule 5.